Good afternoon, bon après-midi. Bienvenue à notre conférence de presse virtuelle. My name's Anne Lagacé-Dowson. I'm the Director of Communications for the Canadian Health Coalition, where we're very concerned about recent reports of 2 deaths and 1 case of severe kidney injuries following plasma collections by Grifols. Plasma collection, we feel, should be guided by the principles of the Crever Commission inquiry report that came out in 1997 after the trauma of the tainted blood scandal. After 8,000 people died, there was supposed to be a shift to the precautionary principle with regard to blood and blood products. So today we have for you a number of speakers on the issues that are raised by these unfortunate events. And I'm going to start by throwing to Noah Schultz. We'll try and keep the interventions short, and then we'll take questions from the media at the end. Noah?
I was going to say, I thought the host had to unmute me. Perfect. Great introduction. So I'm Noah. I'm the provincial director of the Manitoba Health Coalition. And as Ad said, we're all here because of the loss of life, the injury to another Manitoban while donating or having harvested plasma at Grifols locations. And we're here to continue to sound the alarm that the profit motive within healthcare, including within plasma donation, causes harm, causes profit-driven corner cutting, and has in this case potentially led to really tragic outcomes. We're also responding to Grifols' testimony at the HESA committee just last week, a really unresponsive, evasive testimony that didn't tell us a lot about what is going on behind the scenes. So the Manitoba Health Coalition and other coalitions are calling for a ban on Grifols and other pay-for-play plasma. We echo the Standing Committee on Health's call to disclose the contract between Grifols and CBS. And ultimately, we do all this because we don't want more Manitobans and more Canadians to die for the profits of Grifols or any other multinational company of this kind. So in Manitoba, we're also calling for judicial inquests, independent inquiries into the deaths, so we can get answers to protect the public in the future and answers, of course, for the friends and family of those who died.
So I think the next speaker is now Siobhan Vipond, Vice Chair of the Canadian Health Coalition. Sorry, Siobhan needs to be unmuted.
Yeah, sorry, I unmuted myself and I think I got remuted. Hello. Yeah, so I just want to start with what brings us here today. And so just to acknowledge that, the 2 people who have died at the for-profit, these are horrible situations. And also the person who's now got a kidney injury. And so just condolences to those folks and to, the families and caregivers and those that knew them. Because taken together, this is really pointing to something deeper, right? How did something as essential as blood plasma become a for-profit business, and at what cost? So right now, a multinational corporation, Grifols, is operating in Canada and making money off plasma collection. And who are they collecting from? Well, research shows plasma donors are often younger, they're lower income, and financially vulnerable. And this is what corporate greed looks like in our healthcare system. So since 2022, Grifols has been operating through an agreement with the Canadian Blood Services, an agreement we have yet to see. And this deal opened the door for-profit plasma collection in Canada. It created loopholes under, around the provincial bans, and it really blurred the line between public healthcare and private profit. At the same time, Grifols is allowed to collect plasma at nearly twice the frequency of Canadian Blood Services. Are these rules about protecting donors? Or are they about maximizing supply for profit? So because when people are donating plasma just to make ends meet, that's not really a donation. That is economic pressure, and no one should have to sell anything like this, your body parts or your plasma, to feed their families. So we're here with very clear demands, and you're going to hear all of us speak and how we're on together on this, but we need to return to a system based on voluntary, non-paid plasma donation as recommended in the Crever Commission. We need to end for-profit plasma collection in Canada and bring it fully back into the public system under the Canadian Blood Services. And no more secret deals when it comes to our blood supply. The agreement between Canadian Blood Services and Grifols must be made public. And finally, we need stronger oversight, better data, and real accountability to ensure that donor safety is never compromised. We believe our healthcare system should serve people, not rank in profits for an international corporation. Because when profits come first, safety is compromised, accountability disappears, and it's Canadians who are paying the price. We've seen this before in Canada's blood system, and we cannot afford to repeat those mistakes. So today, we are calling on governments to act, protect donors, protect our public health system, and to make it clear that in Canada, people come before profit, always. Thank you.
Next up is Chris Galloway of Alberta's Friends of Medicare.
Thanks, Anne. And as Siobhan said, this is a very tragic situation, and we're glad to see the House of Commons Standing Committee on Health is taking this seriously. But it's frustrating to see that Grifols doesn't seem to be showing that same level of concern. You know, the CEO had to be forced to come testify before the parliamentary committee, and we would expect that they now comply with other requests from that committee. It's also frustrating to see that they don't seem to take their compliance with the Food and Drug Act and blood regulations seriously when it comes to protecting Albertans and Canadians. Reading through the inspection report for their collection site in Calgary was shocking. There's a dozen regulatory criteria where they are not meeting compliance, including things like that they did not accurately assess the donor's suitability, they did not thoroughly investigate errors and accidents, they did not carry out sufficient corrective and preventative actions when required, that the cleaning, maintenance, and calibration of critical equipment were not always sufficient, and that the operating procedures were not kept up to date or followed. And what was the response from Health Canada, the measures they took? We requested corrective actions and may conduct a re-inspection. That simply isn't good enough for protecting Calgarians at these sites. You know, when public health finds a restaurant or housing that poses a serious health or safety risk, caution tape goes up and the place gets shut down. How are these pay-for-plasma sites still open across the country when they're being found in non-compliance with safety regulations? That's not meaningful enforcement. These sites need to be shut down, and we need a judicial inquiry into what has happened. But we also want to remind folks that there are public solutions that don't involve corporate profit motives or paying individuals for plasma, and that when we do it that way, it works. In 2020, Canadian Blood Services opened a new plasma donor center in Lethbridge. It showed us successfully that if you give Canadians the opportunity to donate voluntarily their plasma locally, that they will do it. They will show up and they will do that. We don't need to be continuing down this profit-driven road with a for-profit corporation. And just finally here in Alberta, I want to say that, you know, we had a ban on pay for plasma here in Alberta. Unfortunately, a private member's bill came forward that the Conservative government passed, repealing that ban. What's happening now shows why that ban is crucial and why we need to bring it back here in Alberta and across the country. Thank you.
Thank you very much to Chris Galloway and the Friends of Medicare in Alberta. And now our next speaker is Natalie Mera, who's going to introduce some people who are very close to the issue in the Ontario Health Coalition. So Natalie Mera.
Thank you very much, Anne, and thank you for being here. So, I mean, at this point, I think really families of the people who've been harmed and who've died, their communities, and the whole community of people who are reliant on blood and blood products absolutely need some answers and some accountability, and it still has not happened. In Ontario, there has been another inspection that has been disclosed of what Health Canada identifies as the Oakville head office for Grifols. I've put the links to the inspection reports, the non-compliant inspection reports, including the one in Oakville, in the chat for media. And at this point, what has been revealed recently, I think is really shocking. In context, the inspections of Grifols have shown non-compliance more times since it started operation only 3.5 years ago than all other blood and blood products collection sites in Canada in the last 14 years. I'm just going to say that again. What has been revealed from Health Canada is that Grifols has been found non-compliant more times in just their 3.5 years, they're brand new, of operation than all other blood and blood products collection sites in Canada over the last 14 years. That alone should say that this is a warrant for serious accountability and action. And that's why we're calling for these centers to be shut down. In Ontario, everywhere where there's a Grifols collection center, there's a Canadian Blood Services Plasma Collection Center. Jeff Keane is the co-chair of our Protection of Ontario's Blood Supply Committee. He's committed to this because he is a retired staff member from Canadian Blood Services and has a lot of expertise on this. I'm going to turn it over to him to talk about the inspection reports.
Thanks, Natalie. Chris has gone through much of what the inspection reports have revealed, and I have to say that we are disappointed that the investigation into these deaths through Health Canada has been 6 months in the making, and still we don't have any reports. We've experienced the effectiveness of Health Canada in protecting Canadians in the past, in the 80s and 90s, in the tainted blood scandal, contaminated blood transfusions, the failure to properly screen donors and test blood, the same sort of things that we're experiencing now. It took months of investigations, lobbying, and 4 years of the Creaver Commission to get a resolution, to get a recommendation. We can't go another 4 years for investigations to find out what's behind this. The Ontario and other provincial governments need to enforce their Voluntary Blood Donations Act, to shutter up these clinics that are open, and for the Canadian Blood Service to expand their blood collection system, as is their mandate.
Thanks, Jeff. And the other co-chair of our committee also has expertise on this because she's a medical laboratory technologist and understands fractionation and what these blood products are used for. So I'm going to turn it over to Sarah LaBelle, who is speaking from the Ontario Health Coalition as a co-chair of our Protection of Blood, Ontario's Blood Supply Committee. Go ahead, Sarah.
Thank you, Natalie. And thank you everyone for joining us here today. We're here due to tragic deaths that may have been preventable if we had, followed the principles from the Creaver Commission. In Ontario, we have a Voluntary Blood Donations Act that prohibits paid plasma. It was passed in 2014 with all parties unanimously supporting that act, and it was enforced until a few years ago when Grifols opened their first clinic in Ontario. And Canadian Blood Services is using the agency act that, they can get someone else to collect the product. But in Ontario, there is nothing in the act that allows agency collection. So Canadian Blood Services has no right to allow Grifols to take blood products from patients in our sellers in Ontario. We are asking the Ontario government to enforce the Voluntary Blood Donation Act in Ontario and to, close the Grifols facilities. Plasma is a safe process. The donation of plasma is extremely safe when there is proper screening of donors, when donors are healthy, when it is done correctly. And in fact, under Canadian Blood Services, there have been no deaths. And so we are asking for our government to enforce the not-for-profit blood services contract, to enforce the no paid plasma, the Voluntary Donor Blood Act in Ontario, and to ensure that we are doing it ethically and properly, which is exactly what Canadian Blood Services has done. In every single community in Ontario where there is a Grifols site, there is a Canadian Blood Services site that could take over and actually do the extraction of plasma in a safe way, so that we are doing it for the good of patients, not for profit. So those are the things that we are calling for, and we will continue to call for these things until the Ontario government does the right thing. And across Canada, we will continue the fight with everybody else to make sure that we are doing the right thing by Canadians.
Thank you, Sarah, Jeff, and Natalie, and thank you to all the earlier speakers as well. We're going to open it up to questions, and I'm going to ask those people who have questions to put their name and outlet in the chat, and we will unmute you in order to allow you to speak your question, or alternatively, you can simply put your name and outlet and question in the chat, and we'll try and get to you. And we will get to you. I wanted to mention that at the Health Committee, the Standing Committee on Health, also known as HESA, the committee ordered unanimously Grifols, the Canadian Blood Service and Grifols, to produce the confidential exclusive contract that was signed between CBS and Grifols by April 10th. So we'll all be very curious to see that. And ideally, that contract should be made public as well. There's no reason why it was kept so very, very secret, or at least some of the terms of that contract should be revealed. So please do jump in and put your questions in the chat, and we'll try and get to any media outlets who have been following this. And we'll try and give you we'll open up the floor. Any members of the group that's speaking today can certainly try and jump in and address questions. So far, I'm not seeing any questions. Is that because we've answered them all? That would surprise me somehow, but perhaps people are having difficulty signing on. Is that possible? What do you think, Sala? Do you want to jump in and maybe help me with this? It sounds like it looks like it might be a technical issue.
It may be a technical issue. If it is, just so folks know, the toolbar at the bottom of your screen, you'll see the chat button over there, and you can use that to write a message in the chat.
Okay, there's a question here from Kat Lontang to everyone. So Kat wants to know, has anyone found out about the third death? There is apparently a story. We don't have a lot of information on this, but there is, I guess you can't call it a rumor, but we have heard that there was a third death, and I wonder if anybody has any information on that. Perhaps you can jump in, Natalie, I don't know. I should mention
all of the public reporting so far, there has been no information on that we've seen.
Right.
Okay. Yeah,
except for the year, except that it was in the last 10 years. Sorry, Noah, go ahead.
Oh, that it happened in Winnipeg, that it happened in 2018, and at a site that has now been taken over by Grifols, but I don't believe it wasn't officially a Grifols site at that time, but it was a private run site, not a CBS site, and it speaks to a larger pattern of harm at for-profit centers. And unfortunately, Manitoba has the distinction of having these deaths all in our province.
There is a story that the CBC did that was just put into the chat by a friend that said 3 people all in Manitoba died after giving plasma in the last decade. And that's according to Health Canada. That's a story by Kristen Annable, Annable, byline, that was posted on March 13th on the CBC .ca webpage. So that would indicate that there is confirmation on that. So not a rumor, in other words. Any other questions? We did send out a press release as well as an advisory. We sent out a news release just at the noon when we started this news conference, and we sent out an advisory. So there are phone numbers on those documents for people to follow up and call any of the speakers that you're seeing today. We do hope any media that's on this call is going to be calling CBS and Grifols for reaction, in addition to Health Canada, to see what they have to say about this. Oh, wait, here's Michelle Allen, who wants to ask a question. I wonder, Sally, could you unmute Michelle Allen?
Hi, yeah, my question is, why do you think all the deaths have occurred in Manitoba? Grifols and other private clinics exist throughout the country. Do you guys have any theories as to why Manitoba seems to be particularly?
Michelle, are you with the CBC? Michelle Allen? Can you hear me?
Michelle unmuted, but yes, Michelle is.
Okay. Michelle's with the CBC. Okay, so interesting question. Maybe we should start with Noah on the question, which has to do with why the problems so far documented seem to be in Manitoba. So what do you think, Noah?
Well, I mean, partly this is why we need investigations to find out the particulars. I'm cautious to speculate too wildly, but I do think about the profile of folks, as Siobhan and others have emphasized, who tend to be attracted to pay donation. It is more vulnerable folks, people who are giving because they're incentivized to give frequently, and so this can mean they have downstream health effects. We also have a lot of inequality, a lot of poverty, a lot of vulnerability within Manitoba. One of the people who died, we know, was an international student who was only 22. And we know that international students have a host of health and financial pressures on them. They pay well beyond what domestic students do for their tuition. And of course, in Manitoba, don't have access to public health care. So you have to deal with the two-tier for-profit healthcare system, and that puts lots of financial pressures on folks. So it may just be that we have particularly vulnerable people within Manitoba, and that across Grifols, there's a pattern of non-compliance, of poorly training and maintaining their staff and their technologies, their machinery. And so that may all come together. But truly, this is why we need the independent judicial inquests. This is why we need to know as much as possible about the deaths of these people and the conditions, how often were they donating, and more. So, the biggest thing is we just need answers for the families and friends and to make sure that people feel safe donating, especially publicly, and understand that this kind of death is not normal and shouldn't be happening.
I'm just going to jump in to say that Michelle Allen is one of the co-authors of that CBC report that I just quoted. So thank you for that. Sorry, Michelle, I didn't spot your name in the byline. Does anybody else want to jump in to try and respond to Michelle's question?
Hi, thanks. I'll just have a comment there. Thanks, Noah, for that. And I think you're correct in your summation, but these infractions are at multiple collection sites across the country. So it's not in Manitoba, of course. The Grifols report card doesn't get just a need to improve B minus. They shockingly failed, and failed across every circumstance in operating a plasma collection clinic.
If I can just add to that, if you don't mind, we don't know of any other deaths, but what we can see from those inspection report summaries is repeated note that Grifols failed to comply in a number of sites and repeatedly across the country in proper procedures to follow up and address adverse events at their facilities. What that raises is that there were adverse events at their facilities. We don't know what they are. We don't know the details of them. And one of the things we're calling for is disclosure from Health Canada of the full inspection reports, not just those summaries. And this is very like long-term care, if you think about it. We need the full inspection reports, and we need to understand the nature of those adverse events. And we also need to understand, because they were also found to be too frequently, I mean, they're already allowed 104 times per year in taking plasma out of people's blood, which we know is, already at that rate brought into question by the meta-analysis, the meta-analysis from 2024 that was done. But in addition, they were found to be taking more frequently than that at the Regina location. So just notably, adverse events that we don't know what they were that are cited in those inspection reports.
It's interesting that the sellers of their plasma, as they're going into the collection sites that have been in the news, have been asked about this. And the reaction is, yes, I've understood, and yes, I've seen things, but I need the money. So this is the other side of the equation, is that donors are willing to risk, sellers rather than donors, are willing to risk their lives and health because of their financial situation. So we must do something to protect not just the blood system itself, but the donors.
I'm just going to jump in and say that there are 17 Grifols storefronts for the purchase of plasma, including 3 in New Brunswick, where my colleague Tracy Glynn lives and works, and who is behind the scenes on this meeting, this news conference. And the ones in New Brunswick are deliberately positioned near the campuses and near low-income neighborhoods where people are, as Jeff was just saying, and Siobhan mentioned earlier, in difficult straits. So that the positioning of these storefronts is often by design near people who are vulnerable, and which makes it morally difficult to accept, I think, for a lot of us. Anyway, I don't know if anybody else wants to.
Sorry.
Go ahead.
I think you need to mute, Anne. Oh yeah, okay. So we have no fault with those who are going to these clinics to give their blood, because they have so many pressures, social economics pressures. But where we're finding fault and where we're calling it out is in a couple of places. One is these predatory companies like Grifols, who are doing this for profit. That will be their number one, no matter what they say in any parliamentary committee, whatever they say anywhere. Their number one purpose is to gain profit. And then also in the governments that are letting them exist without enforcing the rules. And so without transparency and without this being in the public interest, this is what we're going to continue to see, and that is tragic. So there is a big cost to pay for everybody in Canada when this continues to be allowed. And so we are coming together to really push the government to say, this is not acceptable. There's another solution. Canadian Blood Services is the solution, as long as they have to be transparent and continue to, have a public system for our blood and plasma, because that is our best way forward. And that is an important message that we have a clear ask around.
Any other comments from our panel of speakers today? I don't see any further questions in the chat.
I was just going to add to the whole, plasma donation. Plasma donation is safe. It's safe if the individual is healthy. It's safe. The recommendations are that you hydrate prior to donating plasma. It's recommended that you eat a high protein meal. And as many people have already highlighted here, when these storefronts are being opened up in areas where there are vulnerable populations, those are populations that aren't necessarily as healthy as, people who live in other neighborhoods, because social determinants of healthcare matter. They don't necessarily have access to have a high protein meal, because maybe they're donating because they're trying to buy something to put food on the table for their family. So they're already compromised prior to even coming in. And the global market for plasma was over $36 billion in 2024. It's expected to grow to over 70 billion in 2034 and up over 114 billion by 2040, and probably even more than that when they do the projections. So there is a reason why Grifols has opened up in the areas that they've opened up, because they have people that are going to, need to frequently donate in order to make ends meet. It is not their fault. There are, so many issues in our society that could be helped through, better supports, but they're pushed into this situation. The only way we can protect them is to make sure that our governments across the country are ensuring that we have a voluntary donor system rather than exploiting a vulnerable population.
Does anybody else have any comments to close our news conference?
I just have one comment. Grifols announced last week that it planned to sell off part of its U.S. operations in a public offering, which begs the question, will Canadians' health soon be guided by stock performance? Will the shareholders' expectations determine the safety of our blood system? It's very distressing to imagine how that might impact.
That is a very good point to, I think, end the proceedings for today. And I want to thank everyone who spoke and those who have joined us. And once again, I just mentioned that we sent out an advisory as well as a news release with the follow-up phone numbers and emails of those people who spoke today, should you wish to pursue any of the topics that we've touched on. And thank you very much to our colleagues at the various coalitions across Canada. Thank you to Salah Shadir and to Tracy Glynn for their support. in getting this news conference together. And thank you to all. Bonne fin de journée.